Hi, my name is Dr. Eddie Joe, and today we're going to go over the proper setup before blood flow restriction or BFR therapy or training. Right here we have the Smart Cuff system from Smart Tools fixed on the subject's right arm all the way up to the armpit. We already have the gauge slash pump connected to the cuff right here. And before we move forward, before we inflate it to the pressure that is needed for his training or therapy, we want to find the pressure that elicits full arterial occlusion, also known as arterial occlusion pressure. One way we can do that is by using an acoustic Doppler system, which also is provided through the Smart Tools Smart Cuff system. So we'll take this probe, place it around his radial artery, and listen for arterial flow, a sound like a whooshing sound, okay? Now, once we identify that arterial flow, we're going to pump this up until that sound goes away. Now, the pressure that is indicated on the gauge will be the arterial occlusion pressure. Now, once you find the arterial occlusion pressure, you want to deflate it to the appropriate pressure for the training slash therapy. For the upper body, for the upper limb rather, it is roughly around 50% of the arterial occlusion pressure. For the lower limb, it is roughly around 80% of the arterial occlusion pressure. Okay, so once you deflate it to the appropriate pressure, you can disconnect the pump right here. The subject can get up and go ahead and do his curls. Okay, so this is how to properly set up the cuff before you engage in blood flow restriction training or therapy.